conference, and I think it's important to empower yourself and learn as much about it as possible. Today I'll be talking about ocular sarcoidosis. And so if you, how do I get that presenter mode off? Okay, great. So the eye is an extremely delicate structure. And the inflammation in diseases like sarcoid, I think a good way of thinking about them is sort of like a fire in the eyes. Both in the way that it presents, a lot of times when people have an acutely inflamed eye, it's painful and it's red. And maybe the worst thing is when you start to lose vision, you become panicked and it can become very psychologically impactful. But even after we put out the fire, using medicines, it can still leave damage in its wake. So even when the active inflammation is done, it can cause permanent damage. So here you have a burnt down house, and here you have an eye that has evidence of chronic disease from something like sarcoid. The goal in treating inflammation caused by sarcoidosis is to put out the fires at the first sign of smoke. So we want to catch it early, and we want to treat it aggressively before any of these fires go out of control and can cause permanent damage. So right now, if you think about where the treatments of sarcoidosis have been, or especially inflammatory diseases of the eyes, we're in a golden age of medicine. 70 years ago, we didn't have any treatments for inflammatory diseases of the eye. In fact, they thought all inflammation in the eye was due to an infection. And so they would treat people by putting them in these hot baths. Basically, eye doctors would watch patients go blind before their very eyes because these treatments were extremely ineffective. These days we have much better treatments, which provides hope, but I think it also, the fact that this much medicine has changed this much in 70 years also kind of hints at how much things will continue to change. And so we're in this state where medicines and treatments are constantly changing, and I think there's a lot of hope for the future as well. The treatments we have today are mostly tailored towards treating inflammation, and I think as a number of our presenters have already pointed out, the inflammatory process is what causes a lot of the damage in sarcoidosis. So generally, you have an organ, so in this case the eye, and when it sends out a signal to the rest of the body, it'll send out a signal to the immune organs and the cells throughout the body, and then these cells will come back to the eyes, and they'll try to heal the eye, but in that sense, it causes inflammation. The eye is a unique structure, though, because the eye is one of the few organs in the body that has this innate ability to stop inflammation on its own. It's called ocular immune privilege. And along with a few other organs of the body, so here you have the eye, and then here you have the brain and the reproductive organs. These are the only three places in the body that have this kind of innate ability to stop their own inflammation. But something about sarcoidosis is able to break through these natural barriers we have, and as we've alluded to earlier, sarcoidosis can actually affect the brain quite dramatically. It can affect the reproductive organs, and it can affect the eyes. And so it's something that is pretty unique about this disease. So this is saying 25 to, depending on the study you look at, about 25 to 50% of people with sarcoidosis will have ocular manifestations, meaning things will go on in the eye, so maybe 25 to 50%, depending on the study. And this is inflammatory disease, and so it's, by some estimates, the third most common organ behind the lungs and the skin involved in sarcoidosis. And so we see this quite a bit in our clinics. And like Dr. Graham alluded to, the classic teaching in our training programs is also that ocular sarcoidosis can look like anything. It is the great mimicker disease. If you flip to a random page in an ophthalmology textbook, you'll see that sarcoidosis can probably cause what's on that page. And so Just a few things that can be involved. You can have, the lids can be involved, the muscles around the eyes, the coat around the eyes, that's called scleritis. The cornea can be involved. Kind of anything going from the outside in can be involved. And so I'm going to talk about a few of the things, but the main thing we worry about in the sarcoidosis clinics is the inflammation of the eyes, because when left unchecked, inflammation can cause potentially blinding damage to the eyes. So inflammation is the smoke, so sometimes you can even have inflammation without any symptoms. But generally, most people will have symptoms when their eye is inflamed. It'll be red, it'll be angry, it'll be painful. You may have notice changes in vision. And vision loss is the fire. And so the ways that we figure out that there's inflammation in the eyes is simply during an eye exam. We can look. Normally, when we shine a light into the eye in a very specific way, this should be completely clear. But when there's inflammation in the eyes, it's sort of like a projector light in a movie theater. You'll see little particles of dust floating around, and it'll look like fog in the eyes. And depending on how much kind of dust and fog is in the eyes can help us quantify exactly how much inflammation is in the eyes. We can tailor therapy based on that. And then other parts of the eyes also show evidence of inflammation. So the front of the eyes here, these same cells that are floating around the eyes are now stuck up against the surface of the eyes. And so if you have any signs of inflammation in clinic, you will likely receive treatment from the eye doctor. But those are examples of inflammation in the front of the eye. About 2/3 of patients who have inflammation from sarcoidosis have only inflammation in the front of the eye, which we can often treat with topical medication. When the inflammation spreads to the back part of the eye, we worry more, because inflammation in the back part of the eye can actually result in more dramatic vision loss. If you have inflammation in the back part of the eye, that's often, more likely than not, an indication for putting you on systemic therapy, meaning pills and immunosuppressive medications, as we alluded to earlier. So inflammation in the back part of the eye can present in a lot of ways. This is not an out of focus picture, this is an in focus picture, but the inflammation, the inflammatory cells in the eyes are so heavy that it's almost like when we look in the eyes, it looks foggy, and when you look out of your eyes, it looks foggy, so this can cause dramatic vision loss. And another thing it can do is it can swell the back of your eye. This is sort of one of the most common ways that inflammation in the eyes presents. And so in the clinic, we'll take this picture of your eyes, and in a normal eye, the center of your vision in this scan is usually just a dip and has a nice shape. You can see all the layers like a wedding cake. But when your eye is inflamed, you can see these little spots of fluid that form in your eyes. It distorts the shape of the back of your eyes, and that can cause acutely decreased vision. By treating the inflammation, this is reversible, but when you have fluid that builds up in your eye and it stays there, that can cause permanent damage to the photoreceptors in your eye. It can cause permanent damage to your vision. And so if you have any changes in vision, that would be a reason to come in, because this is reversible if treated early. And then this is a picture of a normal eye, but the back of the eye can be affected in a whole bunch of other ways. This is an eye affected by sarcoidosis. These little white spots are granulomas in the vessels, and the vessels have basically all become damaged, and so that the blood flow to the back of the eye has been destroyed. If this happens, we call it a vasculitis. This can be irreversible, because damage to the retina is sort of like damage to the brain, in the sense that our body is unable to produce new retinal tissue once that tissue is damaged. And so the whole idea is to treat this before it gets so severe and starts taking away blood flow to the back of your eyes. And of course, the brain also plays an important role in vision. The eyes, if you think about how the light comes into our eyes and it hits the back of our eyes, but then that signal is transmitted all along our brain. And so we know that sarcoidosis can affect the brain as well. So even if the eyes aren't actually involved, you can still have vision loss from sarcoidosis if, for example, you have a stroke in a part of the brain that that deals with vision. So blindness is a possible outcome for uncontrolled sarcoidosis, and only in very, very rare instances would you have a case where sarcoidosis causes an immediate, irreversible, blinding level of vision loss. So I want to assure you that this is not quite as common as the other causes. So the ways that you could have sudden irreversible vision loss would essentially be to have a stroke to your brain or a stroke to the back part of your eye, that, or the vessels in the back of your eye that provide blood flow. What's more common is that sarcoidosis comes in kind of two flavors. The first is you have repeated attacks, you have repeated flares, and if you think of flares like a fire, each time you have a fire, it leaves damage. And so the vision slowly gets worse over time as the flares continue. And then the other way is that if you have a long chronic disease, so that the fire is smoldering and slowly burning away the tissues in your eyes. In both cases though, if you have that, they can be often very well controlled with immunosuppressive medicine, including topical steroids and oral steroids if necessary. So the whole theme of what I'm trying to get to here is that if it's treated early enough and aggressively enough, a lot of these can be avoided, and a lot of them can be reversible. Cataracts are reversible, dry eyes are often treatable, swelling of the retina is reversible, glaucoma and uveitis are both things that we can treat with medicine in the clinic. The most common manifestation is dry eyes. That's not included in the 25 to 50% of bigger. In fact, I would say most patients with sarcoidosis will have dry eyes to some extent. That's because even small amounts of inflammation to the tear glands occur in most patients with sarcoidosis, and even a small amount of inflammation here can cause drying of the eyes. In addition, the medicines we use to treat uveitis can also cause dry eyes. And so ways to go blind, basically the ways to go blind would be if the disease goes uncontrolled. And so the key is to have early and aggressive treatment by an eye doctor if you start to have any symptoms. So about 4 out of 20, so about 20% of people with ocular sarcoidosis will develop glaucoma, either from the disease itself or from the steroids we use to treat it. Both can cause glaucoma. And essentially what glaucoma is when the pressure in the eye goes high and it causes damage to the optic nerve, which is the nerve that controls vision. And then damage to central retina, so posterior uveitis. About a quarter of the people with ocular sarcoidosis will have posterior uveitis, but again, this is treatable. And then damage to neural tissue or stroke, as I mentioned earlier. That's how people go blind usually. And then the treatment for the eye reflects its unique nature. Much like the skin, we can see it. So for many cases of sarcoidosis, we can treat it topically. We use pink top drops. Those are steroid drops. Most commonly in the case of sarcoidosis, we use something called Durezol, which is a stronger one, but Pred Forte is also a commonly used, or prednisolone acetate, that's a commonly used drop. If you have bilateral disease, chronic disease, sight-threatening disease, or disease that isn't responding to topical drops, we'll often have to use systemic steroids, steroid-sparing agents, and biologic therapies, same therapies that are involved in other organ systems. The unique thing about the eyes, though, is that because they are immune privileged, the dose that you need to treat eye disease is often higher than the dose that you need to treat other diseases. And so if your disease is well controlled everywhere but the eyes, that alone will be an indication for increasing the therapy. And the most important thing is regular eye exams, and I would advise you, so there's sort of two types of eye doctors. They're ophthalmologists and they're optometrists. Optometrists are fantastic for healthy eyes, but if you have an unhealthy eye, I would recommend that you see an ophthalmologist who are medical doctors. They're more experienced in dealing with diseases of the eyes that are potentially blinding. And then if you have inflammation in your eyes that's active and progressive, it would be advisable to seek a specialist's opinion. And so we have one specialist in uveitis in the state of Alabama. His name is Dr. Russell Reed at UAB. And if you have inflammation of the eyes, I would recommend that you get plugged in with a uveitis specialist, but at the very least a medical doctor who can manage these things, because they can progress. And then if you have eye issues off hours, the other sort of practical information I would give you is that I wouldn't go to a regular ER because the facilities at normal eye emergency, or the facilities at normal emergency rooms are usually not sufficient to diagnose eye diseases, and so I would go to an eye-specific facility. On hours, your ophthalmologist, but off hours, there's an eye emergency room in Birmingham. And so take sarcoidosis, common and variable, good prognosis if early and aggressive treatment, good follow-up with an eye doctor, you take your drops. Worst prognosis if there's a long delay with an eye doctor. And untreated eye disease can be blinding.
Thank you so much. With that, I get to release everybody to lunch. Since we've got such a narrow space here, we're going to ask that your left side of the room gets up and goes to lunch first.